In today's video, doctors and nurses are turning down jobs to work at the VA hospital under Trump's administration, and we are going to talk about it. So make sure you stay tuned for all of the details. But before we begin, as always, welcome back, everyone. So very happy to have you back for another update. Let's go ahead and get started. Veterans hospitals are struggling to replace hundreds of doctors and nurses who have left the healthcare system this year as the Trump administration has pledged to slash the Department of Veteran Affairs staff and improve care. Many job applicants are turning down offers, worried that the positions are not stable and uneasy with the overall direction of the agency, according to internal documents examined by ProPublica. And the records show nearly 4 in 10 of the roughly 2,000 doctors offered jobs from January through March of this year turned them down. This is quadruple the rate of doctors rejecting offers during the same time period last year. The VA in March said it intended to cut its workforce by at least 70,000 people. And last month, department officials updated their plans and stated that they would reduce the workforce by 30,000 by the end of the fiscal year, which is September 30th. Many staffers had left the job voluntarily. The agency said in a press release that mass layoffs would not be necessary. After 6 years of adding medical staff, the VA this year is down more than 600 doctors and about 1,900 nurses. The number of doctors and staff has declined each month since President Donald Trump took office. The agency also lost twice as many nurses as it hired between January and June, records viewed by ProPublica. In response to questions, a VA spokesperson did not dispute numbers about staff losses at centers across the country, but accused ProPublica of bias and cherry-picking issues that are mostly routine. And the agency spokesperson continued to state that the department is working to address the number of doctors declining job offers by speeding up the hiring process, and that the agency has several strategies to navigate the shortage, including referring veterans to private providers and telehealth appointments. A nationwide shortage of healthcare workers has made hiring and retention difficult, according to the VA spokesperson. The spokesperson also stated that the recent changes at the agency have not compromised care, and as of early July, the average wait time nationally to schedule outpatient surgery appointments for new patients was 41 days, 13 days higher than the goal set by the VA and nearly 2 days longer than a year ago. Nationwide records reviewed by ProPublica show the vacancy rate for doctors at the VA was 13.7% in May, and that is up from 12% in May of 2024. The spokesperson also stated that those rates are in line with historical averages for the agency. And while the vacancy rate decreased over the first 5 months of 2024, he stated it has risen in 2025. And in the VA's Texas region, which covers most of the state, officials reported in an internal presentation in June that approximately 90 people had turned down job offers due to the uncertainty of reorganization and as well as low morale, causing existing employees to not recommend working at the VA medical centers. It is not just the loss of doctors and nurses impacting care. There's also a reduction in support staff who have not been protected from the cuts, and that is also adding to the delays. Now, some facilities are experiencing trouble hiring and keeping mental health staff as well. And the Trump administration has dramatically scaled back the use of a key tool designed to help the VA attract applicants and plug gaps in critical frontline care. The VA in recent years has used incentive payments to help recruit and keep doctors and other healthcare workers. In fiscal year 2024, the agency paid nearly 20,000 staffers retention bonuses, and over 6,000 new hires got signing bonuses. In the first 9 months of this fiscal year, which started October 1st, only 8,000 VA employees got retention bonuses, and just over 1,000 received recruitment incentives. And the VA has told lawmakers it has been able to fill jobs without using the incentive programs. Republican Delia Ramirez said during a congressional oversight hearing in July that the Trump administration is withholding the bonuses because they want staff to leave as part of a plan to privatize the VA services. What are your thoughts on doctors and nurses turning down offers to work at the VA hospital, a job deemed stable and protected for so many years? This is unfortunate that this administration is causing such chaos when healthcare is such a viable service that's needed for so many. Make sure to share with us in the comments how you are feeling about doctors and nurses turning down job offers to work at the VA hospital. And don't forget to like, subscribe, hit that notification bell, and come back for more updates. Bye-bye.